So they can hear me now.
Yes.
Good evening, everyone. My name is Rochelle Walton Gray. I am the COVID-19 Vaccine Acceptance Community Outreach Coordinator, and I welcome you this evening to our town hall meeting about the COVID-19 vaccination. Today, we will have several speakers who will touch on various topics related to the COVID-19 vaccine. We will start our program off with the County Executive for St. Louis County, Dr. Sam Page, and he needs no introduction, but if he wants to say a few things about himself, he can. But we welcome greetings from Dr. Sam Page.
Thank you, Rochelle, and thanks for your help with the vaccine outreach. This is a big project, and thanks for everyone on this panel for helping us with vaccine acceptance. And we're focused tonight about vaccine acceptance, and we have been for a couple of months now in North County, where we know is our population that's the most impacted by COVID-19, the most at risk, and where we've concentrated our vaccination efforts, but we know we still have a challenge with vaccine acceptance. When COVID first hit our community, we focused and made a commitment to focus our resources on the most vulnerable populations, and we did that with as soon as St. Louis County had testing capability, we opened that up in our Berkeley campus and started joining our health system partners in providing testing services. We'll continue to respond to the pandemic based on our need for our most vulnerable communities, not just with the public health response, but also the humanitarian response and the economic response. We know and understand decades of disparities, predominantly in our underserved areas, much of that in North County, and we focused our pandemic response on those who need help. There certainly is a conversation in the community about relaxing public health orders. We know the communities that would be the most negatively impacted are those where the vaccine acceptance rate is not as high as it should be. And that's why, as we have these very difficult conversations about easing restrictions as the case numbers begin to fall, we need to redouble our efforts to make sure that we have more acceptance and a greater vaccination rate in North County. Last week, we received a special permission from the CDC and the state of Missouri to have a vaccination zip code specific event in North County, which we did, and we are looking to have another one in the next couple of weeks where we only vaccinated folks from a specific zip code. That is one tool in getting the vaccination rates up. But what we really need is this conversation about acceptance, and that's why we put this program together tonight, and that's why we're really, really grateful for the speakers that have joined us. Thank you for letting me say a few words. I'll step back and let you go on with your program. I've got another event to get to, but I'm very proud of our North County stakeholder group that's focused on vaccine acceptance, and I really am grateful for those of you that joined our program tonight to help talk about the vaccine. Thank you.
Thank you, Dr. Page. So next, I want to introduce our moderator for this evening, Dr. Miranda Avant Elliott. She is a lifelong learner and community leader. She earned a Bachelor of Arts degree in accounting, a Master of Teaching degree in special education, and a Master of Education degree with the emphasis on urban leadership. Dr. Avant Elliott earned an education doctorate degrees from St. Louis University in educational leadership, where she was also inducted into the Golden Key National Honor Society. She has worked passionately and served the Missouri Public Schools for over 17 years. She is licensed in the state of Missouri as a special ed teacher. In addition to a successful career as an educator, Dr. Avant Elliott currently serves as an alderwoman and president of the board of aldermen for the city of Bellefontaine Neighbors for a second term. She was recently honored as an African American elected official by the Urban League of Metropolitan St. Louis. And with that, I would like to introduce you to Dr. Miranda Avant Elliott.
Hello, everyone, and thank you so much, Rochelle, for that introduction. We're going to begin our program with Dr. Monica Williams, and I'm going to share a little bit about her before we begin. And we do have Q&A, so please feel free to put questions in the Q&A while we're having the presentation. So Dr. Williams is a graduate and also a faculty member with Washington University School of Medicine. And a lot of her research has focused on minority aging, minority research, participation, Alzheimer's disease, bioethics, and health disparities. She was appointed to the Dermatological Society of America, Biological Sciences, Executive Committee, and Committee on Minority Issues on Dermatology. Currently, she is the medical director for New Horizons Living, a program of all-inclusive care for the elderly, PACE, in St. Louis. She is involved in the community. She's clergy, health professional, education, and outreach. She's a member of the National Medical Association and Mound City Medical Forum, a Missouri chapter of the NMA. She was elected president of the Mound City Medical Forum in 2006. At this time, speaking on COVID-19 vaccine, I present to you Dr. Williams.
Good evening, everyone. Thank you for the opportunity to present. Today, I'm going to be discussing information about how the COVID-19 vaccines were developed and how important they are, and also discussing their effectiveness and safety. So just to tell you a brief blip about myself, and many thanks for the introduction, Dr. Avant Elliott. So Christian Horizons is the parent company for which I work. There was a concern in the 60s among chaplains that long-term care at that time was more focused on patient and disease and not as much on a holistic approach to individuals. So in 1962, Christian Horizons was founded by a group of chaplains who worked in long-term care, and the ministry provides care across the spectrum from independent living to long-term care and skilled care in 4 states in the Midwest, including Illinois, Iowa, Missouri, and Indiana. And New Horizons Living is the program of all-inclusive care for the elderly, which is a national program with that serves thousands of older adults nationwide with 50+ programs in various states. New Horizons Living is a new program that will start in St. Louis, and we will open in 2022, and it's a model of care that provides an alternative to being placed in long-term care. Mound City Medical Forum is the Missouri chapter of the National Medical Association. We serve as the voice of 200 African-American physicians in the region. So I wanted to cover a series of questions that have been commonly asked about the vaccines. So one question is, how do the Pfizer and Moderna COVID-19 vaccines work? So just to give you guys an overview, there are 100+ COVID-19 vaccines currently in development. The first 2 vaccines that got Food and Drug Administration review and then the emergency use authorization were the Pfizer and Moderna vaccines. So there are multiple levels of review for the vaccines. So first, they go to the Food and Drug Administration, Center for Biologics Evaluation and Research. They go to a committee that includes a bunch of national experts in vaccine development who review all the research information related to the vaccine and determine if they recommend it for emergency use authorization. And then subsequently, the Centers for Disease Control has a committee, again, of specialists in vaccine development who then review it. And then for a third level of review, the CDC director approves. So both the Pfizer and Moderna vaccines are messenger RNA vaccines. So this is the classic image that we've been seeing for the past year. This kind of tennis ball shape with the spikes on it, that is SARS-CoV-2, the virus that causes COVID-19. So if you take that sphere and kind of that tennis ball and cut it in a cross section, you'll see these little red outpouchings, which are the spike proteins. the spike protein that's seen on SARS-CoV-2, the virus that causes COVID-19, is unique to the virus. And you can imagine it kind of like landing gear. With the spike protein, the virus is able to attach to our cells and enter our cells. So the vaccines that were developed by Pfizer and Moderna contain genetic material to make that spike protein. Again, the spike protein is unique to this virus. It's not something that we would see in other places or in our body. So one thing that's relevant to understand is that mRNA technology, the media kind of implied that it was brand new, but it's not. mRNA technology for vaccines has been studied for decades. And these kind of mRNA vaccines have been used in cancer treatment for over 10 years. So what happens with the COVID-19 mRNA viruses is that they give our cells instructions, essentially a recipe for how to make a harmless piece of protein that the body would recognize as the spike protein. And so our bodies recognize that the spike protein is not one of our proteins. So the body builds antibodies that will teach the body how to respond if you were exposed to the virus again. So if you were exposed to SARS-CoV-2, the virus that causes COVID-19, your body would be able to reactivate an immune response to the virus. So two common questions. Can an mRNA vaccine give me COVID-19? It cannot. It does not contain the virus. The other question is, can the mRNA vaccine change my DNA? It cannot. mRNA has a short time that it's in the body, and it cannot integrate into your DNA. So the Pfizer vaccine and the Moderna vaccine are those messenger RNA or mRNA vaccines. The Johnson and Johnson Janssen vaccine, that's the newest one to get the emergency use authorization, has a different mechanism of action. So it went through the same emergency use authorization review process with the Food and Drug Administration, the Centers for Disease Control, and the Centers for Disease Control Director. Vaccine distribution for Johnson & Johnson has already started, and to date, as of the data today, over 2.7 million doses of the Johnson & Johnson vaccine have been administered. So the Johnson & Johnson vaccine uses what's called an adenovirus vector. So adenovirus is just your typical common cold virus. So what they use, and this model has been used for some time for other vaccine models as well. So you take a virus and you make it inactive, so it can't make you sick. It's not able to replicate, to copy itself and make you sick the way a cold would. All it can do is when you get vaccinated, it tells your body how to make, again, that spike protein to make the antibodies. So this vaccine can't make you sick. It doesn't cause those usual cold symptoms, and it's not COVID-19. It's a harmless virus that's not active. It just enters the body and, again, gives that recipe, the instructions for how to make the spike protein. So again, the vaccine contains DNA that tells your body how to make the spike protein. It's harmless to the body. It just serves as a way to get that message to your immune system to make the spike protein. And it's just like with the mRNA vaccines, your body makes a spike protein, your body recognizes the spike protein as foreign to you, and you develop antibodies. And the Johnson & Johnson vaccine is a single dose vaccine. So Dr. Tom Frieden offers a couple of good ideas for understanding these vaccines. So an mRNA vaccine does not contain the virus itself. So the Pfizer vaccine, the Moderna vaccine do not contain SARS-CoV-2. So it's like an email that's sent to your immune system. It shows what the virus looks like and how to kill it. So it's sort of like a Snapchat message. It disappears. Amazing technology. So COVID-19 vaccines don't stay in the body, not the Johnson & Johnson or the Pfizer and the Moderna. What they do is they activate your immune system to fight the virus, and then they disappear. And that's really the rationale behind any of the vaccines. They make your body make a good immune response so that you don't get sick from the illness. So one of the things that the Centers for Disease Control recommends is that when you get the vaccine, protection from the vaccine is not immediate. So with Pfizer and Moderna, there were 2 doses in the series. So 2 weeks after the second dose, you're fully vaccinated. And the Johnson & Johnson is a 1-dose vaccine. 2 weeks after that dose, you're also fully vaccinated. And one thing to consider is that no vaccine is 100% effective. But one thing that the studies have shown for these 3 vaccines is that they're extremely, extremely highly effective. They reduce the risk of COVID-19 disease substantially. So because of the fact that no vaccine is 100% effective, and we're still dealing with the pandemic, what the CDC recommends is even after you get fully vaccinated, continue to wear a mask, try to avoid crowds, continue your physical distancing, staying at least 6 feet away from people, continue that cautious, proactive hand hygiene, follow the CDC travel guidances, and follow quarantine guidances. And that's evolved somewhat. So the CDC had that recommendation that once you're vaccinated, quarantine may be more optional if one is asymptomatic. And then, of course, wherever we work or where people might be in school, there can be different guidelines based on workplace or school location. So just to drive this home a little bit more, so the process through which the vaccines were reviewed was very thorough. So it's not like there was a different standard for these vaccines because of the urgency of the pandemic. They've gone through a very careful review process. And one of the things that I really like is that they made everything public. So if you were so inclined, you could sit and watch about 8 hours of discussion about the vaccinations, first with the Food and Drug Administration, then another lengthy session with the Centers for Disease Control, where they reviewed all of the information and how they analyzed everything, and all of it's transparent, and you can listen to them when they vote. And they've made the whole process very, very clear to the public. So, for example, the summary information and all the analyses that they had were made public, and then also the discussions that occurred were all public. So the Food and Drug Administration Advisory Committee and the Center for Biologics reviewed and authorized Pfizer and Moderna in December of 2020. And following the emergency use authorization from the Food and Drug Administration, then the Centers for Disease Control reviewed. And again, these are very detailed processes. And then the vaccine started in healthcare systems, long-term care, and then rolled out to more of the population. And then for the Johnson and Johnson Janssen vaccine, the exact same process occurred with multiple levels of review by experts in the field. So one question people ask is, will more than one dose of the vaccine be needed? And for the Pfizer and Moderna vaccines, those messenger RNA or mRNA vaccines, 2 doses are needed. So for Pfizer, it's administered 21 days apart. For the Moderna vaccine, it's administered about 28 days apart. And again, Johnson & Johnson is a 1-dose vaccine. So one thing that hasn't gotten a lot of media attention is these vaccines didn't just fall from the sky. There have been decades and decades of research development. It's just that vaccine research development is not something that necessarily gets a lot of attention in the news, but in the background, these studies have been conducted for years. So there's actually, and I can have the links sent on to anyone in the audience who would want it. There's a really nice article, like a lay press article from the American Medical Association, that explains how Dr. Peter Hotet's working with a whole team of virology or virus and vaccine researchers at research centers throughout the country have been working for over 10 years. Their concern was that coronaviruses in the past historically have been associated with some outbreaks. And so they wanted to work on the science of getting a really good vaccine. So the spike protein on SARS-CoV-2 is unique to SARS-CoV-2, but spike protein is kind of a coronavirus trait that you see in different types. So the coronavirus that causes COVID-19 is the 7th coronavirus identified. The other ones that have been known for a while, the reason they're called corona is because they look like a crown, and it's those spike proteins. So as Dr. Hotet said, you can consider that spike protein to be the soft underbelly. Like if you're trying to slay the dragon, getting to the soft underbelly is what you want. And it's an area that makes the virus vulnerable because it's what the virus uses to get into cells. So they've been studying this for 10 years, and they determined that the spike protein was really the right location. So these vaccines didn't just fall from the sky. As I had said, the mRNA science has been studied for over 4 decades, and looking at the spike protein as a target has been going on for 10 years. So just to reiterate, the Food and Drug Administration, the CDC, have carefully reviewed all the research data themselves. They've repeated all the analyses, and the vaccines have very, very impressive safety data. When we talk about an allergic reaction from one of the vaccines, those are extremely, extremely rare. And all 3 vaccines have completed the same careful review process. And when we talk about reactions to vaccines, they usually occur within 6 weeks. And the really reassuring thing is that we have 8 and 9 weeks and greater of safety data for all the vaccines that are available. So if you look at that 6-week window, we already have data that's beyond that. And with the continuation of further observation, we have even more data. Plus, we also have the community-based data from the millions and millions of vaccines that have been administered in our nation, and even more that have been administered globally. So we have that kind of real world information as well on safety and effectiveness. So in order to look at the safety of a vaccine, the Food and Drug Administration typically advises about 3,000 participants. But for the phase 3 trials that have occurred for the vaccines, there are 10 times or more participants than what's recommended by the FDA. So 30,000 to 50,000 participants enrolled in the studies. So one of the reasons why the clinical trials were more efficient is because the barriers to having efficient clinical trials were taken away. So for example, in terms of the review within an institution, the review process can take weeks because people, if there are 15 people ahead of you, you have to wait. But because of the pandemic, clinical trials for these vaccines were expedited for review within the review committees. And the other thing is everyone wanted to volunteer for studies. There were a lot of people that were very enthusiastic about volunteering because of the concern about, one, you could get access to the vaccine faster, two, trying to stop the pandemic so we can get back to normalcy. So they had a huge number of participants. They had a huge number of research teams across the world that were working full time on this project. So that eliminated a lot of the time barriers. And so the studies were even much larger than the usual vaccine studies. So we actually have more safety and effectiveness information than we usually would. And safety is still a crucial priority for the FDA, the CDC, and the medical community. So everyone's really worried about these vaccines being safe. That is a huge priority. So it's not that there was any change in their mindset. And with the review process for the clinical trials and for the government review with FDA and CDC, the same bar, the same standard that's used for all vaccines applied to these vaccines. So no corners cut, no difference in the rules for safety and effectiveness. So another question is, how much does it cost to get vaccinated? Through the federal government plan, it covers the cost of the vaccine. There are no out-of-pocket costs. If people are insured, their insurance is billed to administer the vaccine, but the individual would see no cost. And then if someone's not insured, the Health Resources Service Administration, or HRSA, covers the cost. So there's zero cost for vaccine for COVID-19. And another question is, if people have had COVID-19, should they take the vaccine? The answer is yes, because the immune response from the illness itself is not as potent, or the duration of it isn't as good as when you get the vaccine. So vaccination is offered to people if they've had asymptomatic or symptomatic SARS-CoV-2, that virus that causes COVID-19 infection. And the clinical trial data show that it's effective for people even if they've had prior COVID disease. If someone has current active COVID-19, they would wait until their symptoms have resolved before they take the vaccine. And there's not like there's a waiting period between having your COVID-19 infection resolved and getting a vaccine. Early on in the winter, they were saying you could wait 90 days based on the real world information that we had, that people typically don't get a recurrent infection in 90 days, but there's no obligation to wait 90 days. And sometimes you can have recurrent illness in that time interval. So one thought is get your shot once you've recovered from COVID-19. Another question is, what are the ingredients of the various vaccines? So for the Pfizer vaccine, it has that messenger RNA. That's just the instructions on how to make the spike protein. And then it has lipids, so essentially fats that are normally seen in the body, and it helps to get the vaccine into your system. And then just the usual electrolytes. You can imagine kind of a little bit like what's in Gatorade, and then it's used, a little bit of sterile saline is used to dilute it. So it's the fats or the lipids that help to carry the snippet of messenger RNA in, and some saline and some electrolytes. Moderna is very similar. It has the same thing. It has a type of messenger RNA that tells the body how to make the spike protein, and then it has the lipids and then some compounds that help to balance chemistry and a little bit of sugar. So the Johnson and Johnson vaccine is that one where you have a cold virus that's been knocked out, so it can't make you sick, but it just helps to bring in the DNA that encodes for the spike protein. And then again, a little bit of lipids. It has polysorbate 80 and sodium chloride. And when anyone gets the vaccine, this is part of the review that's given prior to giving the vaccine, to review the ingredients and make sure that there are no issues. So one of the things that the CDC advises, if anyone's allergic at any severity to any component of the vaccine, so that would be polyethylene glycol for the Pfizer and Moderna, or polysorbate 80, then that would be a contraindication if there's an allergy. And anyone who's had anaphylaxis from the vaccine or any component that would be a contraindication. So again, this is extremely rare, but for example, there was a doctor in Boston who got his first shot, and he was on the news because he explained that he gave himself his EpiPen because he had anaphylactic shock and would not take a second dose. And again, you can get the information online, but when you go for your vaccine, it will be reviewed with you in detail. And again, allergic reaction to any component of the vaccine is a contraindication. And one of the things that's part of the process nationwide in every state and city is to have appropriate medical treatment to manage an immediate allergic reaction should it occur, and including an anaphylactic reaction. This is the same thing that's done for every vaccine when it's given. Again, reactions are rare, but all the precautions are in place. And that's one of the reasons why after you get your shot, if you have a history of, say, anaphylaxis to shellfish or fruit, even though it's not related to the vaccine and there wouldn't be cross-reactivity, just with that history of the allergies, they watch you for 30 minutes. The rest of everybody else who doesn't have a history of anaphylaxis, you're watched for 15 minutes. Another question is, once you take your first 2 shots or your 1 shot of Johnson and Johnson, when would a booster dose be needed? That's one thing that we're still learning more about. So currently, beyond the 2-dose series, there's no other recommendation for a booster. One of the thoughts is with the variants that are occurring around the world, there may be an additional shot that would cover variants. That would happen in the future. But for now, you get your 2 shots or your 1 Johnson Johnson and you're finished for now. And again, the vaccine cannot cause COVID-19. None of the vaccines contain the virus that causes COVID-19. It contains genetic material, the DNA or the mRNA, that encodes for the spike protein. And this is harmless to you. So you cannot get COVID-19 from the COVID-19 vaccine. Another question that came up is, can the vaccine cause Bell's palsy? So the vaccine can't cause Bell's palsy based on our current evidence. What we know is that a few participants, 4, who received the Pfizer vaccine, and none of the placebo participants had Bell's palsy. But here's the thing. And for Moderna, it was 1 in the placebo group and 2 in the vaccine group. But the thing is, Bell's palsy just occurs in the population, about 15 to 30 cases per 100,000 people. And the rate in the studies it was 11 per 100,000 for Pfizer and less than that for Moderna. So there's not a rate of Bell's palsy that's higher than what you'd see in the typical population. So the vaccine does not cause Bell's palsy. And in terms of what the American College of Obstetrics and Gynecology is advising, there currently are clinical trials with pregnant women for the COVID vaccines. Those are ongoing, but actually in the studies, some of the participants who were women of reproductive age actually were pregnant unbeknownst to them when they started the study. They were observed and there were no issues for that number of women that were in the study. But what the American College of Obstetrics and Gynecology recommends is these are not live vaccines. Live vaccines are not administered in pregnancy, but vaccines that are not live, such as these, can be administered. And one of the things that we know that concerns us greatly, you've probably seen the news stories, COVID-19 in pregnancy is associated with an increased risk of ICU admission, with ending up on a ventilator, and with death and also with adverse pregnancy outcomes like preterm birth. So there are a lot of concerns about people contracting COVID in pregnancy. So what women are advised to do is talk to their OB-GYN about whether or not it would be recommended for them to get a vaccine. And for women in healthcare particularly, women who are pregnant or breastfeeding are often getting the vaccine because of the concern. And also they've shown that it does help to give an immune response to the baby as well. So the baby ends up with some antibodies that potentially have the protective benefit. And again, for breastfeeding, no information that the vaccines would be a concern. American College of Obstetrics and Gynecology says, talk to your doctor to make an informed decision. Another thing that was going around on social media that's completely inaccurate is that the vaccine causes infertility in women. There are no data to support that the vaccine affects reproduction, and mechanistically, it wouldn't be feasible. And the interesting thing is, if you try to look this up, it's actually tagged as incorrect information. So this is what they were trying to say on social media. So you see this protein here. So this is a protein that kind of looks like, do you remember those curlers that you'd sometimes use for special events back in like the 90s and early 2000s that would make the spiral curls? So it kind of looks like 3 of those with a little bit of thick pasta, right? So that's the syncytin 1. This is a protein in the placenta. It looks nothing like the spike protein. This is the spike protein. It's like apples and oranges. They look nothing alike in terms of the way your body would respond to it immune-wise, and there's no confusion. one of the virologists said a good analogy would be if a zookeeper walked into the zoo and saw a rhinoceros and then turned and saw a jaguar. And if the zookeeper confused them because they had on the same red collar, that would be confusing the spike protein with syncytin. They don't look anything alike. It's not an issue. And again, the vaccine can't alter your DNA. So the instructions for how to make the spike protein to make the antibodies, it passes through your body quickly. So the mRNA dissolves into its component building blocks pretty quickly. That's one of the reasons why it needs the cold storage. That's why it needs to be used within 6 hours of being diluted, which is why there's the big urgency to get the vaccines into arms as quickly as possible before they break down. And then the DNA, again, also dissolves into its building blocks. Like Dr. Frieden said, these don't linger in the body, they're gone. They can't alter your DNA. All 3 vaccines are preservative-free. They don't contain eggs, they don't contain latex. And so just to reiterate, vaccines are going to be the only way to control COVID-19. Our public health interventions are still crucial. The hand hygiene, the physical distancing, but the vaccines are what are going to get us beyond the pandemic. And one of the things that we can all do in terms of helping with the pandemic and helping our communities is to get vaccinated, to get back to normal life. And then a little icing on the cake, or the donut as it would be, Krispy Kreme has volunteered not only to provide donuts to healthcare providers and vaccinators, but if you have proof of vaccination, you can have a free donut per day, which would not be recommended in terms of a nutritional and healthy balanced meat diet, but you can get a free Krispy Kreme daily for the rest of the year if you have proof of vaccination, which is part of their advocacy for getting everyone vaccinated. And since we're wrapping up International Women's Month, I just wanted to talk about 2 of the researchers. So as I'd mentioned, messenger RNA vaccines have been studied, and mRNA as a mechanism been studied for over 4 decades. This is Dr. Katalin Kairko, who probably will be getting a Nobel Prize, I imagine, for her research. So she has been studying messenger RNA as a means to have vaccines and for various other therapies for decades. And she works for BioNTech now, which is one of the companies that's working with Pfizer on their vaccine. And so her career of efforts is now coming to fruition. And then this is Dr. Kizzmekia Corbett, who is a PhD who's been working actually in the National Institute for Allergy and Infectious Disease with Dr. Fauci for the past 6 years and working on the Moderna vaccine. So for Women's History Month, 2 of the many women who've been taking a lead in getting us access to vaccines. And then at my company, at Christian Horizons and New Horizons Living, one of the things we talk about is kind of the expanded 3 Ws. So you've probably heard the wear your mask, watch your distance, wash your hands part. The other things are wait to gather. It's still advised to wait on larger gatherings and interactions. And then on the other W, the 5th W, is when it's your turn, get vaccinated. Thank you so much for your time and attention.
Thank you so much, Dr. Williams. We're going to save questions for you until the end. That was very thorough. So we're going to move on to Reverend Gabrielle Kennedy. Reverend Kennedy is the pastor of Buren Chapel African Methodist Episcopal AME Church and executive director of Faith and For the Sake of All, a community-based organization committed to race equity in St. Louis. A lot of her ministry focuses on equity, health, and liturgical leadership. She has 17 years of experience in commercial and Medicaid managed care across the state of Missouri, and she serves on various boards and committees, including the Housing Authority of St. Louis County Board of Commissions, Mid-America Transplant Foundation Board, and the Quindaro Township Board of Directors. So at this time, we would like to welcome Reverend Kennedy, who will speak to the people of color mistrust in American healthcare system and our contributions. Welcome, Reverend Kennedy. Nice seeing you again.
Yes, good to see you too, Dr. Miranda, and thanks to Rochelle and St. Louis County for inviting me here for this panel discussion and this conversation today. I'm really grateful to you, Dr. Williams, for your presentation, also because it really is so important that we get the facts about what's happening with the vaccine. And so what I wanted to share, I'm not going to stay before you long. That's the preacher in me talking, and I promise it's the truth. But what I wanted to share with you
interrupt you.
is I wanted to
Reverend
talk
Kennedy,
about, what'd you say?
let me interrupt you. If we can remove the screen so that we can see you better, if we can remove the PowerPoint, Dr. Winslow. Yeah, perfect. We can see you now.
Okay, no problem, no problem. I wanted to what I wanted to talk to you about, those who are sharing with us in this information today, is about how the work that that is before us, the pandemic work that is before us, is work for all of us. This is really more of an inspirational thing, but I think that we'll find some points here concerning our perspective and how we are meeting this challenge that we're in right now. But overall, what I want to say is work is for everyone. Like, it is all of our jobs to respond to what's happening to us in the midst of this pandemic. And I know there are a lot of people out there who might be thinking, I don't know what you're talking about. I'm not in the healthcare industry. I'm not a doctor. I don't educate people on it. I'm not vaccinating people. So why and how is it my job? Well, I believe that we can find a place for each and every one of us to interact so that we can maneuver through this process, especially over the next 6 months, so that we can all benefit from it. So one of the reasons why I'm here is because the St. Louis County has been having this very specific outreach in North County. And one of the reasons for that is because that represents a marginalized part of St. Louis region. It is largely Black residents there. And at Faith and for the Sake of All, where I am the executive director, our job and our focus is really on dealing with issues of racial equity, and specifically structural and institutional racism, and how communities of faith, this is how we enter into the conversation, communities of faith can respond to that, right? This is not new to us, right? We understand that this is a very real part of our history here in America, certainly all over the world, but as our location dictates for us here in America. And so we've talked about for years, coming out of the For the Sake of All report that was published by researchers from Washington University and St. Louis University and led by Dr. Jason Purnell. Our job was to take that data and make sure that it didn't gather dust on the shelves, but indeed to share that with audiences much about it. And so we did that. And mostly with predominantly white congregations who needed to know more about how institutional racism has affected the St. Louis region. And at the same time, though, what we realized is that for an organization who said that we were committed to the health and well-being of African Americans in St. Louis by mobilizing the faithful, we needed to find more ways to directly engage African American faith communities in order to impact predominantly African American neighbors and neighborhoods. And so we began to do that work. And although we all wish the pandemic didn't hit us the way it did, it was because of this very immediate impact from the coronavirus that gave us the opportunity to directly engage with communities of faith around the idea that they needed to also fulfill their own mission of helping neighbors by allowing Faith and for the Sake of All. We did this in partnership with CARES TL Health to use their parking lots to do testing, right? So these were for predominantly Black congregations who were in predominantly Black neighborhoods who were trying to get over this barrier, right, of folks who didn't want to get tested and access things. So when we talk about the barriers of health, right, historically, there are a couple of things. And when we talk about the idea that that we all have a role to play in this, the role that we have to play in this are to make sure that we make that the conversation, that the narrative is balanced, right? So the narrative that we're talking about is, yes, there is hesitancy, right? Because we have a history of distrust. We have a history of abuse, quite frankly, if we're truthful about it. But on the other hand, we also have a history. It's not just hesitancy, it's the barriers that are in place. And so what I said, I'm gonna get right to the point here. When I talk about we all have a place and a job to do here, certainly those of us who are on the front lines, and we thank God for you, for all of our healthcare professionals who are on the front line dealing with this. That's absolutely the case. But I think every single one of us, so whether or not you are in the healthcare industry, or whether or not you are talking with your family, whether or not you're talking to your social circles, whether or not you are in your organization work, all of those places are places to have this conversation. One of the reasons why we're struggling so badly in this pandemic is because we don't have the right information in those conversations. And so that's why I'm so grateful to Dr. Williams for the information that she has shared with us today, because one of the things, and I challenge you to do this. I challenge you as we have a group message that we use, system that we use, right? And so every now and again, I just introduce a question, right? I'm being messy, right? I'm being messy. So I just put a message in there, and I'll say something like, so is anybody planning to get the vaccine? I did this like a few months ago, right? I already know, right, what they're gonna say. And so I got all kinds of reactions. But what it did is it made us start talking about it. We didn't agree. I can tell you right now, we did not agree. But at least it gave us an opportunity. And Dr. Williams, I had one family member say, well, you don't know what's in it. So I went to the website and clicked on that link, put that in the thread. And then I had another one say, well, you know, those folks are making these vaccines for us. I went and got something on Dr. Kesmikia and put that in there. And then another one said, you know, we don't know what this thing is doing to us. Well, what we know is that the virus has killed over 500,000 people. And from what we know, the vaccine has killed 0. That's what we know today, from what we know, right? So these are the kinds of things that it's not necessarily that we want to brainwash anybody, but it's important that people make informed decisions with the right kind of information. So I challenge every one of you to just bring the topic up. Ask a messy question. It might be a little uncomfortable, but it's worth it. It's worth it so that our folks can begin to get the right information. As a pastor, I have folks, congregants who were at the beginning very hesitant. I will say they were very hesitant about it. But as we talk about it over, and when I hear that hesitancy, I just say, here's the information I have. Here's a link. Read it for yourself, right? If you're asking me, when people get the shot, and I'm like, okay, so how did that go? So I have family members who are now reporting out to us and saying, I went to go get my first shot today. So great, how did that go? What symptoms? How is that experience going for you? So these are the kinds of conversations we absolutely have to have, because that's what gives us the opportunity to share, even if it's uncomfortable. Our health, our lives are worth a few uncomfortable conversations. This is the place, I almost called y'all beloved because I felt like I was preaching, but I'm back now. This is the place where we have to be willing to risk an uncomfortable conversation, understanding that our care and love for one another should make it okay to be uncomfortable for a few minutes. So I challenge you to have these conversations. I have people that I work with who are unsure, have not been tested, did not plan to get the vaccine, have not registered for the vaccine. So we were in the middle. I just stopped everything in the conversation. Let's talk about it. Tell me what you're thinking. Let me share some things with you. They still may not get it, but at least now they know. Let me send you to some things that you can read about. Every single one of us can do that. And so I encourage you to do that so that we don't stay in a place where we begin to say, it's about hesitancy and it's about mistrust. Yes, those things are present, but it's also about a system that has clearly failed many parts of the community and continues to fail. As one who is helping to organize some COVID response events, we are trying to get people registered. Amen. The Faith Initiative of the North County outreach effort, we are getting people and we are targeting Black congregations to get them registered and taking a very personal approach in doing that. And the initial instructions that we gave them, trying to rely on the system, did not work. So we had to rework it. So oftentimes when we're up against something that's this big, we believe if we can just rely on the system to do something, and that would be great. It would be great if we could rely on systems that already exist. But if those systems fail us, let us then be ready. What ways can we then look at an alternate approach and be committed to doing that? That's what we're doing in the Faith Initiative of the North County Outreach Initiative. The next thing is that where there isn't a great relation, I really applaud both Rochelle and the whole committee, because what we're talking about is not just our response to coronavirus, but also ongoing conversations about more general health issues that we know are still a problem. Why? Because they've been exacerbated by this pandemic. And finally, we want to make sure that where there are barriers that we always knew existed, let us redouble our efforts to moving those barriers out of the way. They may be uncomfortable conversations with people who are in power, but let us not give up, because we can see that if we all face the same direction, what we can do in our community to make access to healthcare more available for everyone. And so I thank you again for allowing me to be here with you for these few minutes. And at Faith and for the Sake of All, we are continuing to work on this effort. I encourage you to visit us at faithandforthesakeofall.org, or to submit any questions at info@faithandforthesakeofall.org.
Thank you so much, Reverend Kennedy, and I appreciate your courageous conversations with your members and the community, because it's definitely needed in our specific culture. I don't believe there are questions at this time, so we can continue on to our next presenters, which are from Show Me Hope. And so we have Kayla Vescovo and Crystal Strough. You're available. You can begin speaking at this time. And let's see. They will talk about state registration sites and other information related to that.
Everyone, my name is Kayla Vescovo. Crystal was having some trouble joining us, so it will just be me. I have a bachelor's in health education and promotion. I am the public health educator with the BJC Behavioral Health Crisis Counseling Program, and that program is called Show Me Hope. Is able to see my screen right now? It's not letting me see my own screen. Just a second, guys. Sorry about this.
We can see your screen.
I can't see my screen. That's my only problem. So I don't know what slide I'm on.
Oh, okay, okay.
Did it go to the next one for you guys?
Yes, it did.
All right, great. So Show Me Hope is Missouri's crisis counseling program, and this program activates anytime there is a disaster or critical event in Missouri. So for example, the last time that Show Me Hope activated was during the floods. We are funded by FEMA, and Missouri has been involved in this crisis counseling program since the 1970s. The mission of this organization is to assist individuals and communities in recovering from the challenges and effects of natural and human-caused disasters through the provision of community-based outreach and educational services. So Show Me Hope crisis counselors are based in the local community to offer support to anyone that's been negatively impacted by the pandemic. This CCP helps communities recover and rebuild to improve and focus on promoting the use and development of coping strategies, helping people reduce stress, and providing emotional support for people. We also offer disaster preparedness and response education. We also help the community understand current situations and normal reactions to events like this. So some of the free services that Show Me Hope offers includes support groups, and that can be anything from virtual grief and loss support groups. We offer support groups for parents, for teachers, and for healthcare workers. We also have a 24-hour local helpline to answer any questions about COVID-19, about the vaccine, and then we also help connect the community to resources via that helpline as well. We offer stress management, coping skills, resiliency training, health education, response education, and disaster preparedness. So some of the resources that we connect the community to include COVID-19 testing sites, vaccine registration. We help connect people to food assistance, rental and mortgage assistance, utility assistance, transportation assistance, transportation to food pantries, testing sites, if you need transportation getting to your vaccine appointment. We also help connect people to childcare services they might need, employment services, and then again, mental and behavioral health services. So I wanted to touch a little bit on the vaccine registration and the current challenges that was already discussed. So we are focused on the fact that there are low registration rates in the hardest hit communities. There are transportation barriers for this community, technology barriers. There's a lack of trust, which Reverend Kennedy touched on. And then there's a really great need for vaccine education, which Dr. Williams touched on already. So moving forward, going back to connecting those communities. So the map on the right shows that North County has some of the highest confirmed cases of COVID in St. Louis County. And then comparing the map on the left that shows that less than 10% of North County's population is actually registered for the COVID vaccine. So this shows that there is a large vaccine equity gap in that this North County outreach group that we are all a part of towards a joint effort of combating this. And so what happens if this equity gap is not closed? So the community is affected because there will be higher infection rates, there will be higher mortality rates, there will be longer time spent in isolation due to quarantine. There will also be a prolonged recovery and rebuild period after the pandemic is over. And then some of the solutions that the North County Outreach Group has came up with would include the fact that we are planning, Reverend Kennedy touched on this, that a lot of churches in North County are hosting registration and vaccine events to help build that trust factor. And we also talked about helping register people in your family that might not have access to internet, or also helping spread the awareness to your friends and family of this relevant information and where to go to seek these resources in the community. That's all I have, you guys.
Thank you so much, Kayla. Just quickly, how can someone, is there any particular requirement for individuals to get those services that you all provide?
No, so Show Me Hope offers free services to anyone that's been negatively impacted by the pandemic.
Okay, thank you so much. Next, we will have on our program Dr. James Hinrichs from St. Louis County Department of Public Health, and his focus area is infectious diseases. Dr. Hinrichs.
Thank you. Thank you so much for inviting me. That was a great presentation from Dr. Williams. I just want to applaud that. It really addresses a lot of the myths and misconceptions about the vaccine. Just as far as background, I've been in the community at DePaul and St. Joe's and St. Charles and Christian Hospital for about 40 years, and I was semi-retired because my wife had cancer and since passed away. But I became involved with the county as a volunteer for contact tracing, and then they saw my background and offered me a full-time job in May. So I've been with the county since May, helping with some of these issues, trying to get our contact tracing to the point where we could respond to cases, which obviously has been difficult. You know, we're seeing about 140 cases or so a day now, but back in November, we were seeing 1,000 cases a day. And with our workforce, we were just not able to get to so many of those. So we relaxed some of our ways of getting to them. A lot of these people needed release from isolation letters so they could go back to work, et cetera, et cetera. So it's been a challenge. But the nice thing about it is that the page kind of turned a little bit when we started seeing that the vaccine was going to be available. And back in December, the county has been very strong in partnership with the Pandemic Task Force, which you all are probably aware of, which really has brought together the hospital administration, infectious disease people within the hospital groups, the public health people, elected leaders. So Dr. Page is routinely on a call that we have every Tuesday. We get pretty in-depth and pretty heated sometimes when some counties were unwilling to have a mask mandate, which we begged them to do, but we were successful, luckily, with most of the counties. I won't name the one that did not go along, but that has been extremely successful. And I think, along with the stay-at-home recommendations from the county, have kind of reversed the trend in terms of our cases, because in November, we were clearly getting to the point where rationing of healthcare was going to happen if we weren't able to contain the virus. So that was really a very, very dark period that I think all of us probably remember. But in terms of where we're at now with the vaccine, the healthcare systems have been tremendous partners with the vaccine, and they basically, at this point, are primarily concentrating on their most at-risk individuals, which include the elderly in the systems, as well as people with underlying diseases. And throughout the state, I was just looking at the Missouri statistics, about over 60% of 65 plus people in Missouri have the
I know the weather's getting bad.
versus percentages in terms of comment. But more the issues for probably sorry, Ms. Gray. Oh, okay. So Ms. Gray asked me to talk a little bit about the tiers, and we're all familiar with tier 1A, which was basically healthcare workers, which has been virtually taken care of. First responders and other very important first response teams were part of the 1A, 1B, and then the over 65, the most at risk for mortality, was then the next group that came up. But now we're at the point where on March 15th, the governor has said that teachers as well as critical infrastructure should be included, and the county has worked very closely with most of the school districts in St. Louis County in terms of their health nurses to get that available. We started doing that just this week as far as teachers, but that also includes a lot of the other important grocery workers, transportation people, government people. So all of that has been kind of freed up on March 15th. And then the next big pivotal area is April 6th, where where basically the general population, according to the governor should have some access to the vaccine. But it's all dependent on the supply of the vaccine, as we've all been reading about so much. The state is doing a better job at getting the vaccine to us. I think we're getting about 12,000 doses of vaccine a week in the county. And as part of that, we're trying to open up more sites. We're having a kind of a mega event beginning tomorrow at Queenie Park. We've had the Berkeley site, as Dr. Page mentioned, has been open since we started vaccinating in December. We've had a big site at Umsel. And as he mentioned, there's been a zip code preferential treatment to try to get more of the North County population access. And I think all of us within the department are trying to make ourselves available to church groups, et cetera, because we know there are just a lot of people that don't have access digitally to getting registered for the vaccine. So we're trying to free up some of our volunteers. If anybody is interested in terms of any church, that a volunteer can bring a computer and register people while they're at the church. We're also addressing the marginalized areas like homebound people. The Johnson and Johnson vaccine has come in very handy with that. As Dr. Williams mentioned, it's a one-dose vaccine. So for a homebound person that doesn't have to come back, somebody doesn't have to go back in to vaccinate them, and hopefully their caregivers within the household. So we're starting that with the assistance of a lot of the EMS people, because we certainly don't want somebody to get a vaccine in their home and not have access to medical emergent care if they would have a side effect from the vaccine. So we're doing, I think, as much as we can at the Department of Public Health to really focus on the equity issues that we've all kind of been mentioning tonight. And I'd be glad to take any questions that people might have about any directions that we're going or any suggestions that you all have for us.
There's one question. Can an employer mandate that an employee have the COVID-19 vaccine?
That's hotly debated. In the early part, in terms of healthcare workers, et cetera, the hospital systems have not mandated that because these are all released under emergency use authorization. So generally, I think most lawyers don't feel like that's something that can be required. But as time goes on, that may change. There may be legal challenges to that. I welcome Dr. Williams' opinion on that, but that's pretty much what the healthcare systems have been saying.
I agree. So the most healthcare systems, because it's the emergency use authorization, which is what we use, when it's an urgency like a pandemic. The majority of healthcare organizations are not requiring it. It's been a huge area of discussion. So there are some places that are entertaining the thought in the future when the full formal FDA, approval process occurs, which is anticipated to be relatively soon for the mRNA vaccine since they've been out for a bit. But what some places are doing, I know this has been a discussion a lot in aging care for older adults, is what some long-term care facilities are saying is it's not mandatory, but when it becomes mandatory in the future, when you're thinking about the future of, an individual's position with the company, they may not be able to stay. So that's what they're doing a lot on the East Coast. So there's a long-term care facility in Baltimore that has had 0 COVID cases. They went on lockdown the 15th of February, and they've had 0 COVID cases among their residents and their staff. Like the staff literally fill out a question, they get screened, they get tested, but they also, when they're talking about weekend plans. So you're staying at home, everyone else in your home is being very compliant kind of thing. And so what the leadership in that facility have been telling people is, our culture, we have, we're trying to keep COVID out. So if this becomes mandatory, it's unlikely you'll stay with the company, but they have such good benefits for their staff that their vaccination rate is super high. But so yeah, it's not now mandatory for anyone, but I could see it occurring in the future for sure.
And
A couple of other, pardon me?
I was just going to say, I'm aware of one facility in St. Charles County that is anticipating before they open to make it mandatory for the people they hire to be vaccinated. So there are ways that you can try to make it a little more acceptable and safeguard. Because in the early part of the pandemic, the long-term care facility death rate was, it represented about 50%. It still represents about 50% of our St. Louis County deaths are in that group. So it's a tremendous challenge to allow visitation. My own mother was in a healthcare, in a long-term care facility. She passed away in December, not directly from COVID, but she had dementia. We weren't able to visit her except through a screen sometimes. And when she finally went on hospice, we at least were able to see her face to face before she passed on. But so many families have not had that option.
Couple of other questions. How is DPH ensuring the safety of undocumented immigrants? And also, are there any considerations for the unhoused?
Well, we do. I know at the county, when we have a positive case, that we first screen to see if they require a translator. And our case investigators do use a service in order to get that information. We do not ask about immigration status or anything like that. We're just trying to give them information to isolate, to quarantine their household members. So that's something we certainly offer if any of our cases that become positive have that need. You're on mute, Rochelle. Or not? Oh, there you are.
We do offer interpretation services, correct?
Yes, we do. Yeah, to anybody calling in, and also any cases, just so we can protect their whole household by giving them information that they need to quarantine household members, and many times trying to find out where they may have been exposed to the virus itself.
I think that's all the questions. And pardon me, the custodian came in the office and startled me, so my apologies. And he's singing, so I had to keep turning the mute off, on rather. So I think that's all of our questions.
I wanted to. I don't think we were able to talk anymore about the unhoused. I know that some of the inquiries that we have been around. Is there a way to get those who are unhoused neighbors directed towards Johnson and Johnson, since it's a one shot deal and requires less upkeep, and as we're talking about a transient, possibly a transient demographic here. Any particular efforts underway?
I think, well, we're going to have more pop-up sites where we actually have a mobile truck that goes to some of these sites. So if they're in, and you're right, the Johnson and Johnson vaccine would be a perfect solution for that. I know WashU they have an adolescent kind of a bus that they use that they've offered us, and I think other people have as well. Right now, that's a very labor-intensive thing. Obviously, we're trying to concentrate on getting as many doses into arms as we can. But if you have specific areas that you think might benefit from that, please get them to us, and we might be able to set up a mobile van or even a National Guard site for some of those sites, because they have more mobility.
I'll do that.
Thank you.
Yes. It appears that we're currently working with the Department of Human Services to vax people who are in temporary shelters, emergency shelters, and other scattered sites. I know someone mentioned possibly asking Minority Health, which is under DHSS, if they could put a mobile unit out, because they do that with the testing site. So that's another option. But I did want to touch on a couple of things before we end. Of course, everyone knows there have been several mass vaccine sites that have been discussed on the news. I want to make sure that everyone is very clear that those sites do require registration and you must have an appointment. So although they are advertised as mass vaccine sites, this just means we have a larger number of persons, but the process is pretty much the same. But as was mentioned, we are targeting zip codes. Last Saturday, we had an event in North County at the North County Rec Center, went very well. A lot of the legislators were there and helped get that issue with zip codes rectified through the governor's office. Just to mention, our community outreach group has been going very well. If anyone has any innovative ideas about how to get people registered, we'd appreciate it. But the meetings and our subcommittee meetings have really gone very well. So I appreciate everyone who's been participating. So I want to just reiterate, do your research and get the information, but get registered, even if you aren't fully convinced or fully ready to get the vaccine. It won't hurt to be registered. So when you get the information or you see your friends, you'll already be on the list and you won't have to wait as long. Today's event at the Metro North Fire, it targeted the 631, 35, 36, and 37 zip codes, and they had almost 600 residents served today. So that was great. So we're getting to the North County area, getting the vaccine to everyone, but we have to be registered, like Reverend Kennedy said. If we aren't registered, we can't get the vaccine. So any final comments from anyone?
Yes, Rochelle, I'll ask some of the additional questions that came to mind for Dr. Williams. Could you speak to herd immunity and the percentage of people who would need to be vaccinated for community immunity?
So, and a lot of the models looking conceptually at how many people would need to be vaccinated are, it's theoretical, but greater than 70%, probably 75%. One of the considerations is that with the increase in variants, which is one of the problems that's definitely occurring, particularly in Europe, like throughout the European Union and the United Kingdom, and then to some extent in America as well, we might need to get closer to 85%. So, and actually it's interesting, that was one of the topics of discussion with the Food and Drug Administration when they were looking at review, because there was good Pfizer data for 16-year-olds, 17-year-olds, and 18-year-olds. And one of the things they commented on was that chunk of the population, because late teens are pretty proactive and receptive to getting vaccination. So they were saying getting those vaccinated gets us closer to the 85%. So we're definitely going to make sure that they can get their vaccine when it's their turn. So it's one of the things that each of us can do as an individual to get our vaccine and help the nation to achieve community immunity. And it's one of the reasons why globally we're concerned about getting vaccine access in other countries that might not have the financial means, because since it's a global pandemic, global community immunity is crucial.
Okay, thank you so much. Reverend Kennedy, are you aware within your circles if there is a database of churches in the affected zip codes and what their capacity may be to facilitate registrations, as far as either having a school where they already have technology or can get technology? What is your knowledge of those, some type of database of churches and their capacity to facilitate registrations?
So one of the things that we're working on now is finding different ways to different phone numbers, let me say that, and setting up a way for people to call into phone numbers where people can help them get registered. There are many organizations who are doing this, but most certainly one of the things that we've done at the church through the churches is that each one of those churches has a contact person who is able to facilitate the registrations at their site. And so what that does is it makes it easier so that every person doesn't have to do it and we can kind of funnel people into these appointment slots at the same time, and do so in such a way that the people in those neighborhoods, as we talk about hesitancy, you know, one of the things that makes that seems to affect people is the fact that, and I'm gonna just be real with it, is that you live in a predominantly Black neighborhood, and you look at the COVID event, and there are very few Black faces there doing anything, including in line. And so making sure that people know that this event is for you, and so we are going to serve you and take you through this process. So each one of those churches has a contact person who is able to walk people through the registration process, and then we can take that information and make sure that they get an appointment. So we're doing that along with taking phone calls from people who are having difficulty because they don't have internet at all. And those are the things that seem to be working in this process.
Thank you so much. And the last question is directed to Dr. Hinrichs and Rochelle. As far as registration, what is the length of time it takes to register, and what are some of the questions that's asked? Is there anything on the application that if someone assists an individual, it might be some HIPAA violations that would occur? What are the typical questions that are asked in the registration process to give individuals an idea of what to expect if they were to assist in that process? You're on mute. Okay.
I can say that the county registration is much shorter than the others that I've registered on. It doesn't take long, but Dr. Henry.
It was the main questions that are come up prior to when the program is expanded to everybody is to make sure that they're in the tiers that are accessible to the vaccine. So if over 65, underlying diseases, so they're going to be asked a variety of questions about whether they have asthma, whether they have lung disease, whether they have diabetes, hypertension, heart disease, on chemotherapy. So that's going to put them into that tier that allows them to go, even if they're less than 65, into that pool. And then now we expand that to include teachers, some of the other critical infrastructure as well. So they won't be able to get an appointment or be called back unless that particular tier is active. But they can pre-register if they're 16 and have nothing, because eventually they will be in the pool that gets a callback.
And of course, what we know is that that's going to change on April 5th. The governor has already said that those parameters will change to include all adults on April 5th. And so, although that is good that we can continue to do that, we also know that when the floodgates open like that, those groups who are marginalized are often pushed to the edges and have a difficult time getting appointments and registrations and getting there, especially when it's decided that those who have registered for the vaccine, those appointments are done. And then if there are other vaccines that are available, it's very difficult for people to leave jobs sometimes in the middle of the day when they've gotten a call that vaccines are available. So these are the kind of things that that as we know now ahead of time that these things are happening, that we can find ways to circumvent them.
Thank you. Thank you so much for allowing me to serve as the moderator for today. Rochelle, it's in your hands.
Thank you very much. I appreciate all of you today for speaking and presenting excellent presentations, more than excellent presentations, and I appreciate you. And I also thank our audience for attending and participating today. Any questions, my email is in the chat, and I put the website, www.stlcorona.com, is where you can get registered. My email is rgray@stlouisco.com. And again, thank you all. Have a good night and safe travels to your destinations. At least I have to get home. But thank you all. Have a good night.
Good night, everyone.